Second trimester surgical abortions are performed for various reasons, including elective abortion, miscarriage management, and for pregnancy termination due to fetal anomalies and/or maternal health conditions. During the second trimester, 15 to 23 weeks after your last menstrual period, abortions are typically performed over a 2-day period but do not require an overnight stay in the hospital. These procedures are known as dilation and evacuation, D&E. Professional Gynecological Services specializes in second trimester termination of pregnancy. In general, this procedure requires a 2-day visit to our office. A second trimester surgical abortion is performed in a similar manner as a first trimester abortion. The patient's cervix must be dilated or opened several hours or days prior to surgery. Since the dilation process is different for every woman, a second trimester abortion surgery may be performed in the same day as the dilation or up to 1 or 2 days after, depending on your progress. If our doctors determine that the 2-day abortion procedure is best for you, it will be imperative that you are able to stay in the area and commit to returning the next day. The first day, we take your medical history, discuss your procedure and aftercare, and begin the preparation for the overnight dilation of your cervix. What to expect during your pre-operative assessment. In a private exam room, you will learn more about your procedure, undergo an exam and an ultrasound, and receive oral medications that may include a pain reliever. Laminaria is required for overnight dilation. If you are given medications, it is important that you follow the instructions provided by your doctor. Cervical softening and dilation is performed by medication and small dilating sticks called laminaria or dilapan. This may be placed in the cervix depending on the term of the pregnancy and your medical history. The laminaria will stay in your cervix overnight and prepare your body for the next day's surgical procedure. During the insertion, the cervix is numbed with a local anesthetic and the procedure typically takes about 5 to 10 minutes. After the procedure, you will rest for a few minutes. You may get dressed when you feel able. We will give you detailed instructions on how to take care of your body overnight and how to prepare for the next day's procedure. What happens next? Depending on how long it takes for your dilation progress to complete, if necessary, the next day you will return to our office for completion. Medication will be administered intravenously in your arm to induce anesthesia or loss of consciousness. Most women fall asleep and do not remember the procedure. After you relax, the doctor will remove the dilation sticks and use suction and gynecological instruments to empty your uterus with ultrasound guidance. You'll be in the operating room for about an hour, but the procedure may take from 15 to 45 minutes. All surgical abortion procedures are performed in our clean, private surgical rooms, and each patient is attended to by our caring health professionals. What to expect after the procedure. In the recovery room, our nurses will monitor you for about 2 hours. You may experience mild to moderate cramping and bleeding. Before you return home, you will receive antibiotics to prevent infection and instructions for post-surgery care. The procedure and recovery period typically takes about 5 hours. Please make arrangements for someone to take you home. Most women can resume normal activities within a few days. You may experience bleeding and cramping for up to 2 weeks following the procedure. Take ibuprofen or Tylenol for cramps and only use sanitary napkins for bleeding. Do not douche or engage in vaginal intercourse for at least 2 weeks after. We encourage our patients to return for a follow-up visit 2 weeks following the procedure. Safety and effectiveness. Second trimester surgical abortions are one of the safest medical procedures. Although rare, possible complications include blood clot, infection, tearing, or retained pregnancy tissue. Professional Gynecological Services promises you will be treated with the dignity and respect you deserve in a caring, clean, and comfortable environment.